Dentists of Reddit. Why do you talk to your clients when they obviously cannot respond? Dentist here. We talk to our clients 1. To let them know we don't think they're pieces of furniture or inanimate objects we're working on. 2. If they're on gas, to check the level of sedation. 3. To pass the time for all of us. 4. To distract them from the procedure. At the start of every visit, I tell my patients to raise their left hand if they have anything they want to communicate so they don't accidentally knock over instruments or disrupt what I'm doing by raising their right hand. If I expect a long answer or see the patient wants to communicate more than yes or no, I tell them to hold that thought, then I take the mouth prop and suction out so they can elaborate. We can understand quite a bit of garbled speech and body language actually. My dentist does it the best. She asks a question when I'm able to talk and then tells some story when I'm unable to. She's very interesting and fun and makes my dentist experience as enjoyable lol. Dentist here. This thread is hilarious and has some truth to it. Some of y'all would make horrible dentists, or are just buttholes. It's sometimes for distraction from what's in your mouth. Genuine conversation. We can still understand you a fair bit. Or because we know we're gonna take the stuff out of your mouth in just a second when we finish asking the question. There's no recognized course that I'm aware of that teaches how to understand this type of speech. You just kind of pick it up. It's sometimes a joke, because we know you can't respond, but lets you know what we're thinking about. If we seriously don't want your tongue wiggling around, it's whenever you hear the high-pitched whistling drill. Then again, if when we're in your mouth, please don't start going nuts with your tongue. We do often have sharp objects in there. Great questions, everyone. Keep them coming. I'll get to you all in time. Finally get to say RIP my inbox. One of my dental fears is that my tongue will act subconsciously and do something like jump into the drill's line of fire. But they always understand what you are saying somehow. It's like they can read your mind, because how the frick you got yes school is okay out of mmmmmmmmm. I assume it must be like when parents understand the pure gibberish their toddlers say. I'm looking at the kid thinking WTF did he just call me, but the parent's like he wants to show you his new Tonka truck and they're right. Hang around long enough and you learn to decipher the noises I guess lol. As an introvert patient, I love doctors and dentists who rock a lovely playlist and get to work without bothering me with small talk when I cannot answer. When getting my wisdom tooth pulled, the doctor told me on the count of 3 and he did it at 2, and while my mouth was locked open I called him a fucking liar. Everyone in the room laughed and then they pumped the nos or whatever for the next tooth. Awesome experience tbh. My dentist talks to me in a way that I don't have to respond. Like describing what's doing and what's coming next. Recommending stuff I should do to care for my teeth. Really sets up a comfy vibe. I used to go to Thailand for dentistry. The dentist and his nurses would chat in Thai so I would just tune out. Then suddenly realize he had just asked me a question after hearing the same sounds repeated 2 or 3 times. My dad's a dentist but he doesn't have Reddit, so I asked him for this. Apparently they can respond. I suppose he developed the ability to understand people talking with sharp things on their mouth. My dad's also a dentist and he's never told me why, but him talking and spinning around the office makes it easier not to laugh when I have to stare up into his eyes or awkwardly hold onto a spot on the ceiling. I once went through a 4-hour-long root canal session and he never said a word the entire time. It was the 3rd attempt by a specialist. I have freakishly long roots. When I got my upper wisdom teeth extracted, it opened air passing holes from my mouth to my sinuses. I couldn't say words with P or B in them for several weeks without opening a hole, and slept with a tube taped to my lip to prevent forming pressure suction in my sleep. My dentist told me to say stop when I felt pain, but there is some tube that collects liquid and mouth prop on my mouth, so I just tapped her when I felt the pain. Ha 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 ha. That laugh makes me think you're psycho. A lot of responses made me laugh. It's uncanny how many of us share similar sentiments. I have a dentist's appointment tomorrow and slightly apprehensive about the experience that awaits me. My dentist makes jokes while working in my mouth and has a tendency to ask questions that cannot be answered. Funny story. One time, I had a stretchy latex covering in my mouth. What are they called? While getting a root canal and reclined pretty far back in the chair with a tool deep in my mouth that made me gag. To which my dentist says, "Looks like we have a gagger." Him and his assistants all burst out laughing. Awkward moment that was. Couldn't contain myself either and resembled someone having a tremor. Still funny to this day. To keep patients at ease. Yesterday we took out a wisdom tooth, and whilst waiting for the patient to get numb, the dentist was telling some story he found hilarious from his uni days. The patient also found it funny. When it came to actually removing the tooth, we'd continue adding little jokes to the story, so the patient is listening to us and the jokes, taking their mind off of the fact that we're currently rotating a tooth around in its socket to break the ligaments and then remove the tooth entirely. Some patients are really grateful for this, as they don't even realize the tooth has been taken out. They just keep trying to talk to us and add to the conversation before asking when we're going to start. All of the people I work with are excellent at calming down nervous patients, and a lot of it is by talking or letting them choose the music we play via YouTube. I'd feel on edge if the people working on me didn't speak to me, so I like to try my best with patients even if they don't seem to want to talk. Just give them something to distract them. Also, sometimes the dentists are actually speaking to me, the assistant, but it can be a question the patient can also reply to, such as, do you play a musical instrument, or discussing a new TV series they've found. As a note for patients, try to keep your tongue away from the area we're working on if you can't keep it relaxed. It's very easy to knock an instrument with your tongue and you can either get cut from it or cause disruption. It can also add to our stress and make it more difficult to work on you. Everything we do is in your best interests. My uncle, who passed away in July from COVID, would calm his patients down by singing to them. He had this special way of making the most nervous people safe in his chair. He'd make jokes and sing Sinatra and Dean Martin for them. It was his favorite. At his wake in July, I had countless people come up and tell me how at ease he put them. They all felt connected to him in their own unique way, it seemed. Miss you every day, Uncle Chuck 143. Capital F. Dental assistant here. I like to talk so that it makes time pass quicker. There is only so many hours you can sit with a suction in someone's mouth before it gets super repetitive. Having said that, I tend to ask yes or no questions and tell the patients to answer me with their thumb. I also gauge it. Some people clearly enjoy the interaction and appreciate the distraction. Others just want to sit with headphones on and tune out. Don't be afraid to tell us what will make the experience easier for you. Cause at the end of the day, we honestly want you to be as comfortable as possible. If you make it obvious you just want to lay in silence, we won't be offended. Just tell us. If you find me hilarious, then let me know, and every time you come in I will chat your ear off. I had a dentist with jokes on the ceiling. Jokes. Patients spontaneously smiling and gagging. He didn't change them either. My latest dentist doesn't do any small talk, so I'm convinced she hates me, and I feel even more tense when I go there. Makes me appreciate the friendly ones, even if you have to reply Gara mmm as saliva drips down your chin. Patient here who had quite a bit of stuff done. They tell me what they're doing, what they find. Also for distractions. Once, I had my phone with me for dental surgery. I had to reply with it. Answered questions back and forth with the phone. Now it took longer than expected and the anesthesia wore off. Their voices kept me distracted from the pain. You have to answer them with your mind. The X-Men have a deal going with the dentists, and it's how they search for people with telepathic abilities. Like the rest of the thread, not a dentist, but I think distraction might be an important tactic. So getting you to think about something else outside of the immediate experience may be beneficial. We do it so our patients feel comfortable. A lot of time we don't want their anxiety to peak, but sometimes it's accidental. I usually laugh when my patients try to talk back and apologize. I had been going to the same dentist since I was a little kid, and when I was like 22 I went in for a cavity that needed filling. I'm sitting in the chair, the man is wrist deep in my face, and he asks if I like music. I managed to reply. Oh good, he says. I'm actually a recording artist myself. I'm gonna play you the song I'm working on. So he turns to the computer, pulls up Windows Media Player and hits play on his mixtape. Then he jams his fist back down my throat. The song is called Sexual Healing, but it's not a cover. It just has the same name, he assures me. I don't doubt his qualifications as a dentist. but he is definitely not a board certified musician. He's drilling into my tooth. The high-pitched whining of the drill is keeping harmony with what I can only describe as an ambient noise recording from the heck where bad cats go. The hygienist or whatever who's supposed to be vacuuming out the spit and tooth dust has stopped paying attention and is gushing to the dentist about how great the song is. Oh my gosh, Dr. Oliver, is that really you? I had no idea you were a singer. I like it way more than the Marvin Gaye one. Don't you think it's great? Bugradminky, indistinct gargling noises. I spent half an hour being waterboarded with my own saliva while he played me a selection of his greatest hits and discussed his blossoming music career with the hygienist. I don't go to the dentist anymore. As someone who has been in the chair more often than I should be, talking with a dentist can be pretty difficult with a drill and a suction tube in your mouth. But the ones I've had usually get the gist of what I'm saying. It's even more difficult when you've got that plastic thing in your mouth that holds your mouth open. They seem to be pretty efficient at interpreting body language and eye contact. Also yelps and screams. Sorry to all the people I freaked out at my first tooth extraction. That dentist was not very comforting and kept telling me to be quiet. I recently had a root canal at a place where their motto was "Your comfort is our primary concern." And let me tell ya, that was a big fat line of bulls. Orthodontist here. It's mostly just a distraction tactic because a lot of people are nervous about dental work. I don't always expect you to respond, but it's just to take your mind off what I'm doing at the moment. It's even better if you can't respond at that moment because then your mind is preoccupied with the question and your response. It's also comforting to hear a human voice while lying down in my chair, so sometimes I end up monologuing. Dentist here. A couple of reasons why I would speak to patients. First, all dentists know that the patients can't answer when we are working in their mouths, so we ask for signs such as a thumbs up down, a left hand up to signal something wrong. Act 1. I want to see how they are doing during the course of a procedure. 2. Talking without patients can distract them from a lengthy procedure that they might be anxious about. 3. It helps me foster a relationship with my patient. I let my patient know that I don't just see them as a procedure but as someone I care for and genuinely want them to get to know me from small talk when they come to the office. Interesting question. Humans communicate more with body language, not just with words, or a shake or a nod of the head. There's also eye movement, facial muscles, shoulder orbitals, and breathing patterns. Dentists are trained to gauge your emotional state. It's basic bedside manner with a sprinkle of confessional. BTW, I'm not a dentist. I just think too much. Edit. You to your. Oh yes we can. I wish I could recall what the final year student dentist said to me that caused me to simply flip him off. Hahaha. That's the first time I've ever been flipped off. Shit and fish sticks. Eyes that shout my thoughts. Yeah, I guess I kinda did deserve it. Funny story. To avoid hearing my tooth extraction at my last visit, I told the dentist I would be listening to a book. She chatted with her dental hygienist, both women, while I proceeded to rip out my tooth. At one point my dentist said something I thought was directed at me, so I paused my book. I proceeded to hear my dentist questioning her hygienist about taking off her top and driving around. Took me a minute to realize they were talking about the hygienist's Jeep Wrangler. I remember my dentist. I was having ceramics installed, and obviously I was unable to talk or communicate anything major, but the dentist was brilliant. He was telling me little stories here and there, but the problem was he was funny and he kept asking me to stop laughing because I was juggling, but I couldn't. The guy literally had me in stitches, which is great and all, but I'm pretty sure the procedure took almost 2x as long. 8/10 would be cut open and injected again for stories -2 points because he smelled of the maxis he had during his break and it was making me very hungry. I think that it is a version of small talk. You listen to them and it kind of distracts you from the fact that one slip up with the drill will hurt very badly. I always thought dentists would have sign language charts on the ceiling. Patients can learn a few phrases to help them communicate without speaking. Dentists. Can you reply? My first wisdom tooth was abscessed and I was young and dumb and didn't know enough to say no. They told me I had to get it out that day. It was 4 PM on a Thursday, the only time they could fit me in. It was impacted and would require what amounted to oral surgery to get it out. They wouldn't do conscious sedation. Basically a cocktail of narcotics, propofol, and maybe some Phenergan thrown in for flavor, because it was too late in the day and instead decided to shoot me full of Novocaine and hope for the best. At one point he was practically in my lap trying to get enough leverage to wrench the shattered pieces of nasty infected tooth out of my head, all while I was completely awake and coherent. He kept telling me to calm down, to hold still. There was blood pooling in the back of my throat, and I was doing my best not to gag and just sat there, shaking and shivering with tears streaming down my face, trying to calm down and be still because they told me to, and at 18, you still do what your doctor tells you. It was something out of a horror flick. It took me 10 years to go back to a dentist again after that. I tried to go, but had a panic attack in the parking lot, and another one in the hallway at the front door, so I turned around and left. After I didn't show up, my new dentist called me and prescribed me Halcion for the next 3 times I came in. I could only step through the door high as frick. It worked though. I go every 6 months now and she's amazing. I even got the rest of my wisdom teeth out, and my oral surgeon was incredible. I felt nothing, remembered nothing. It was beautiful. 10/10. I would definitely go back for all my tooth theft needs. Why would the first dentist do that? I was so confused for so long. My dentist now just shook her head and said, "Oh honey, like it's a thing." I did live in a college town that's known for their MD and dentistry programs, University of Iowa, and I always wondered if he was some kind of resident or intern. Can anyone explain? I wonder if there are doctors that make polite conversation while having a finger up the patient's butt. That's probably the closest we'll get to a perfect ventriloquist. I'm always really confused why patients in the US get knocked out at the dentist. We don't have such thing here at all. I don't know what you are talking about. My experience with dentists talking to me has always been like, lift your right hand if it hurts so I will apply anesthesia. I usually let my dentist know up front that I just prefer to silently let them do their job unless a question is actually important. I'm very bad at small talk, so being upfront about my aversion to it helps. When I'm getting a cleaning I become hyper aware of my tongue and unsure of what to do with it. I know it gets in the way and it's very embarrassing. Please reassure me that it's not just me. As a patient I always try to ask questions before I fall asleep so it gives them something to talk about. One time I asked the dentist to tell the story of how he came to America and realized he wanted to be a dentist. Then I fell asleep. I get gassed every time. The dental assistant said that he talked about that for the entire 4-hour procedure. She learned a lot about him. I like to think I helped them get a closer work relationship. My dentist Maya always talks to me. I thought she was cheering me up, until one day she said, "You are always so sealant." I was like, WTF. I usually have a bunch of scary needles in my mouth. She laughed and said that Vera, my good friend who recommended me this dentist, she and Maya are also friends. Vera points her finger up in the air, letting Maya know that she wants to reply. Maya takes tools out of her mouth. They chat and then continue. The last time I was at the dentist for an actual procedure was about a year after I was married. That was in 2009. The night of our honeymoon, there was a Journey concert in our hometown. I jokingly asked my new wife to postpone the honeymoon by 8 hours. She politely said no. Well, the following year, I went to the dentist. I had been going to this guy since I was at least 6. He's seen me grow up and knows pretty much everything about me. While he has both fists in my mouth and clanging away, he tells me he and his wife just got back from seeing Peter Frampton right before he saw this kick-ass Journey concert. I know it's not smart to call someone working on a very sensitive part of your body a son of a bee, but we all make mistakes. I hope he forgives me one day. Dentist here. Actually, I'm outside the norm and try to keep it to yes or no questions. Still, we want the patients to feel like we're paying attention to their person and that they are in control of the situation if they want to speak up. Also, yes, it's needed to check sedation levels. I actually just hum to the radio most of the time. Question for you guys, would you prefer if we didn't talk at all? That's what I prefer at the barbershop myself. If If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.